Hello, hello. Hello. Takes a little bit.
Fine.
Hello.
We're on right now?
Sorry?
We're on right now?
Yeah, we're on, but they're just notifying people. Hello, hello. Happy Wednesday.
Hello.
How's everyone doing? Hello, hello. Thank you guys for joining us. We are here at Icon Cosmetic Center with
Dr. Dang.
with Dr. Dang. He's here to answer all of your questions. So if you guys have any questions for him, don't be shy. Go ahead and send us your questions and he will be here to answer.
Yeah.
So how are you doing today?
Good. I had a busy day.
Yeah, what did you do today? How many surgeries?
Just a few BBLs.
BBLs, okay. Is that what you usually do? A lot of BBLs?
BBLs is a big portion of what we do, since we're pretty good at it.
Yeah.
But then we do other stuff too, obviously. You know.
What kind of stuff? What kind of stuff do you do?
Liposuction, tummy tuck, breast, whether it's implant, reduction, or breast lifts.
Breast lifts, okay.
Yeah.
Awesome,
And then
awesome.
we do skin resection for patients who lose a lot of weight and you have a lot of excess skin. We do those too.
Awesome. Well, we're going to be asking you a few questions that we get from our viewers on Instagram.
Okay.
So, yeah, are you excited?
Very excited.
Okay, perfect. So, we're going to start by asking, someone's asking, how long should I wait to see my results after a BBL?
Your result can vary. So when you first come out, you're gonna feel like you're black and blue, literally, and then you're gonna feel like your butt is way too big, and then eventually the inflammation goes down and the fat settles down. So usually I would say 3 months until you get a really good result that you can expect that would last.
Awesome.
Yeah.
So, three months around to see
Yeah.
the results.
Uh-huh.
Awesome. Okay, perfect. Speaking of BBLs, how long should we wear the pillow for?
It all depends. I would recommend with my patient at least 2 weeks. You can't sit at all on your butt. And then I would say from 2 to 6 weeks, then you can sit but on the pillow.
Okay.
And then after that, then you can kind of get back to normal life.
So after how long around?
With a pillow,
Mhm.
I would say 6 to 8 weeks.
6 to 8 weeks. Awesome. So if you guys are thinking about getting a BBL, now's your chance.
Yeah.
So I have another question. Do I have to get implants if I want a breast lift,
Uh-huh.
or can I do it without the implants?
A lot of times it all depends on certain patients. Depends on how stretchy their skin is, how much breast tissue you have. And so you don't have to have an implant with the breast lift. And sometimes it's safer and better to do it in staging too. So let's say you want a fullness up top, then depending on your breast and your tissue, we can do the lift first and then can come back and put the implant in. But no, you do not need implant with a breast lift.
Interesting. Okay, there you go. I learned something new.
Yeah.
Guys, if you guys have any questions for Dr. Dang, go ahead and ask us in the comment section and we'll be answering your questions.
All of them.
All of them. You heard him. So we have a few more questions. Can I get a breast augmentation and a BBL at the same time with you?
Yes, but it depends on how healthy you are.
Okay.
Because if you're healthy, then yeah, it can be done. It might be a little difficult because you have to sleep on your chest, but it's doable. Yes.
Okay. Do you have any advice for those who want to do that procedure at the same time for recovery?
No, I mean it's pretty standard. Yes, you do have to sleep on your belly to save the fat from your butt, but it's doable.
Yeah, it's doable.
Yeah.
I know our patients get very creative and cut holes out of chairs. And
Oh yeah, I have heard of that. Yes.
Yes, there's ways for sure. All right. So, what kind of anesthesia do you use?
We use general anesthesia, so you'll be completely asleep. You won't feel anything until you wake up.
You won't feel anything. So you'll just wake up and you'll look amazing.
Yeah.
Perfect. Okay. We have a user who says, I am a person who smokes cigarettes. Will this affect my surgery?
Yes, it does. Smoking is probably one of the worst things you can do for your health in general. But as far as surgery goes, it does negatively impact how you heal, right? You can get necrosis, or your skin can die because of that. It affects the blood supply to your skin, and so your healing will certainly get affected. You can get wound adhesions where the wound opens up. So yeah, certainly smoking is a bad thing for any surgery.
Okay, so try to hold off on the smoking.
4 weeks before surgery of the
4 weeks. 4 weeks. All right, perfect. We have a question here from Merci. Merci is asking, can you do a BBL after doing a gastric sleeve surgery?
Yes, you can, but you do have to have realistic expectation, because weight loss patient is a little bit more difficult. But certainly, yes, we've done that.
Okay, so there you go. So if you're interested, go ahead and send us your name and number here in the corner there. And then we will definitely book you a free consultation. I don't want to miss any questions here. Perfect. Okay, so let's continue with the questions. Do you use an ultrasound for your surgeries?
Always.
Always.
Yeah.
I think that's super important, especially in the state of Florida.
Yeah. We always use the ultrasound.
So don't worry, you'll be in good hands.
Yeah.
Okay, perfect. We have someone who says, I'm from Atlanta. Do you only do in-person consultations, or can it be virtual?
No, we do virtual consultation too. So no worries.
No worries. Okay, perfect.
We have a lot of patients from outside the state, and so we accommodate them whatever is easier for you.
Perfect. Mercy says, thank you. I will do just that. Awesome. So we will definitely be in contact with you. Leave us your full name and your number, and then we will get a coordinator to contact you. Perfect.
Awesome.
All right. So great. We were talking about virtual and in-person consultations. Whatever works for you, you will be taken care of.
Yeah.
All right. Perfect. Next question. I've lost a lot of weight in the last few months, and I have a lot of extra skin.
Mm-hmm.
Do you think a lipo 360 is a good option for me?
No. I actually do a lot of bariatric surgery, and so I deal with a lot of bariatric patients too. But no, you might think you have a lot of fat left, but it's a lot of skin, and so there's really not much to lipo in certain patients. Okay. If you lost like 100, 120 pounds, what you think is fat is actually a lot of skin. And so in your case, you'd have to resect the excess skin to get like a flat stomach. But lipo 360 would not help.
Okay.
If in any case, it might be making it worse, because your skin may be more, you might have more laxity in the skin. Okay. So yeah.
Very good. So probably a tummy tuck in that case, you suggest?
Yeah, tummy tuck depends on where the excess skin is, but we do a lot of tummy tucks for bariatric patients.
Okay, awesome. Can you explain a little bit what that tummy tuck involves and includes?
Yes. So we start with a liposuction. We do the flank, which is on the sides, and that kind of gives you a nice definition when we finish. And then the skin that you have excess, like below your belly or at the belly, at the pubis area, all that excess skin is gonna go, okay? And then we go underneath your skin and the fat layer, and then we plicate, or we tighten your muscle. Especially with patients who have kids, the pregnancy kind of split your muscle apart, and so you have that beer gut. So that doesn't go away with the liposuction. A lot of people think, liposuction will help with that, but no. So what we do, we plicate, or we tighten that muscle in the middle of the abdomen, and then that will give you a flat look. And so, like I said, we pull down your skin, and then suture it back to just above your pubis, where you can hide with the bikini. Your bikini line.
Very nice. So you'll have a nice, smooth, flat tummy, right?
Yeah.
Perfect. Love Me First. Hello, how are you doing? Is asking where are you located? Would you like to answer that, Dr.
We're in
Ding?
Miami, sunny Miami.
Sunny Miami. In
Yeah.
which location are you in?
I'm in Miami,
Miami
location, right across from the airport.
Perfect. So yeah, super close to the airport. So don't worry if you're coming out of the town, out of state. We will be here close to the airport.
Yep, I can literally see the airport from here.
So don't worry about that. Okay, perfect. Thank you so much. We have a few more questions. Guys, if you have any questions on TikTok here, go ahead and ask Dr. Dang. He's here to help you to answer any of your questions or to clear any doubts that you may have. So go ahead and don't be shy. Ask him your questions. So, Dr. Dang, do you have an age limit?
It really depends on the patient, whether you're a healthy 60, healthy 65, or if you're 40 but you're not healthy, then we can't do surgery on you either, right? And so really it depends on your health. But I would say 65 would be my limit, when all patient specific.
Okay, awesome. And what is the starting age that someone can do it?
Starting age 18.
18, perfect.
I think we've had younger patients if they had parental consent. Yeah, a lot of those patients are patients that wanted breast implants.
Awesome. Okay, and I will let you guys know that Dr. Dang right now has his BBLs in $3,750, which is amazing. But you also get 2 areas of lipo for free. Is that correct?
Mm-hmm.
That's amazing, guys. So do not waste this opportunity. Go ahead and send us your name and number here. All right, so we're having a few questions here. Let's see. If I have most of my stretch marks under my belly button, but just a few over, would I need a full tummy tuck?
It all depends on how much excess skin you have, but it does sound like you will need a full tummy tuck. I have to see you to know.
Right,
Okay.
right. So he has to see you. So if you cannot come in person, go ahead and book your free consultation. It can be virtual or in person, and we will definitely help you out. So do not lose this opportunity. Right now, Bless says, where are you located? We are located in Miami, Florida. Dr. Ding here is in the Miami location, which is super close to the airport. If you're interested in traveling, okay? So that is an option for you. Perfect. Can I have my acrylic nails on the day of my surgery?
I believe so. The only thing with that is with anesthesia, because they have to monitor your oxygen level, and they use the finger to do it. But I think there's other ways. I think they can use the ear.
Okay. Very good.
Yeah.
Let's see. Dee is asking, what if I don't want the BBL, just tummy tuck and lower back lipo?
Yeah.
Do you
Go back and tummy tuck. Yeah, definitely.
Perfect, Dee. So don't
You don't
worry.
need you don't need to do anything you don't want to do.
Of course. So go ahead and send us your info, and then we can definitely coordinate that free consultation for you and see which is the right procedure for you. Okay. Perfect. I am a diabetic and I take medications. Do I
Okay.
have to discontinue these medications for my surgery?
No. Take your medication.
Take your medication. Okay, there you go. Any certain medications that you should discontinue before surgery?
Specifically with diabetes, no, because you need your blood sugar control. As far as in general, yes, aspirin, those blood thinners, those pain medication like ibuprofen or Motrin, they're kind of the same thing. If you're on a blood thinner, you need to start your blood thinner for at least a week. Okay.
For a week, okay.
Yeah. What else? If you're on medication for blood pressure, then you can continue those. Those are important to continue to monitor your blood pressure. Okay.
What about psychiatric medications?
No, it should be okay.
Okay, very good. Okay, we're having a few questions here. What is the limit BMI for a tummy tuck? And Lupita is asking this.
Oh, I would say around 30, 38. But I would have to see you to see what I would think is a better procedure for you, because certain people think, I have a big belly. I want to make it flatter by doing a tummy tuck, but that's not always true, right? So I'd have to see you to kind of see what my recommendation would be.
Okay, perfect. So do not doubt in getting your free consultation, and then we can definitely guide you from there,
Yeah.
right? Deli, hello, how are you doing today? She's asking, can you do a BBL and a tummy tuck at the same time with you?
Yes.
There you go. So perfect. If you want that done, go ahead and send us your information, and then we will be in contact with you. Malia says, just had a tummy tuck and BBL a month ago from Dr. Song. Awesome. That's great job. I'm sure
Good.
you look amazing. Okay, and Christina, hello, how are you doing? She's asking, how long is recovery time off work for a Lipo 360?
It really depends on what you do. If you're active at work or whatever, then it takes a little longer. But I would say probably like two weeks to a month.
Okay,
Right.
2 weeks to a month, right? It depends if
It really
you...
depends on how you can tolerate your work.
And it totally depends if you are, active, if you... depends on your job, correct?
Yeah.
All right, perfect. All right, Zaira, hello, how are you doing? What percentage would I have to give down to book? Very good question. All you need is $250 down, and with that, you will be completely good to go. You have a period of time for 2 years, so all you need is $250. Like I said, in Miami, that's nothing, right? So you can totally go ahead and book with that. Deli says, how much is it for BBL and tummy tuck?
What's
You know that one?
I don't know.
Let me see. BBL and tummy tuck, we have... It's starting from $6,500. $6,500 for those two procedures. And like I said, all you have to do is give a $250 deposit down, and then you'll be good to go. All right? Perfect. So let's continue with the questions for Dr. Dang. Let's see. If I have had a C-section done in the past, can I get a tummy tuck?
Yeah, definitely. Especially because we will take care of the C-section incision as well. It will be even lower than your C-section scar.
Awesome.
Yeah.
Awesome. So I'm sure a lot of women like that.
That would be the perfect way to do it, if you had a C-section scar. Yeah.
For sure. That's awesome. Hello, Dee is saying, any tummy tuck specials? Of course. We have right now, let me tell you. Starting at $3,500 with Dr. Dang. So do not miss this opportunity. We have amazing deals right now for the month of October. And guess what, guys? It is literally gone. It is the end of October. So go ahead and send us your name over there. Your name and number for your free consultation. Okay? Sally says, where are you guys? Do you want to answer this question again? Where are we located?
We're in Miami.
Miami, Florida. So we have 2 locations in Miami, Florida. So perfect for you to come. Okay, so hello, Janet, how are you doing? She's asking, after how long can I get a MMO? MMO after
mommy makeover?
mommy makeover after a hysterectomy.
I would wait 6 months.
6 months.
Yeah.
Okay, perfect.
Okay. Make sure you heal from all that first before you do the mommy makeover.
Perfect. Okay. So someone was asking about Stephanie.
Who's Stephanie?
Who's Stephanie? She works in Havana. Apparently. So yes, perfect. Lipo. Naye, did you have any specific question about the lipo? We would be happy to help you answer your question. Perfect. We have a few more minutes left with Dr. Ding, so if you guys have any questions, please feel free to send us your questions and he'll be answering them. Let's see. How long until I can go back to the gym after my surgery?
Depends on which surgery. I would say 6 to 8 weeks usually.
6 to 8 weeks before going to the gym. Awesome.
You still should be walking and doing like a light workout, but full workout gym wise, I would say 6 to 8 weeks.
Perfect.
Okay.
Thank you so much, Dr. Dang. Again, Malika, hello, says, where are you located?
Miami!
Miami, Florida. We have 2 locations here. So go ahead, guys. If you are interested to book with Dr. Dang, do not wait and book your free consultation here. Name and number, your full name and number. Deli is asking, how bad is the tummy tuck scar? Is it noticeable?
It depends on how you heal. Everybody heals differently. But your scar is usually low enough that you can hide it with your, when you wear your pants or bikini. But really depends on how you heal. But for the most part, people heal pretty well. Okay.
Awesome.
Yeah.
Perfect. All right, guys. So do you have any more questions? Please go ahead and ask the questions. What is the price for a BBL lipo 360 and fat removal from arms? Okay, so do you know your prices?
Well, I think the BBL is $37.50, right? We just talked about that.
Yes.
And then I'm not sure how much more to add for the arm.
Yeah, so I do not have the arm prices to add for the arm prices, but you can definitely do that. You can just add on to your package. But go ahead and send us your full name and your number, and then we will definitely make sure you get that information. Traveling from Arizona out of state, how long must I stay after a mommy makeover?
I would like to stay for at least 7 days.
7 days,
Yeah.
okay? So that's after your surgery, guys.
Yeah.
Do not come 7 days before your surgery. Make sure you stay 7 days after your surgery.
You can stay 7 days before surgery and enjoy Miami.
That too.
So that means you stay for 2 weeks if you want to.
Perfect. Do you guys have any more questions? We're about to hop off. I know Dr. Dang is very busy. He has the surgeries to do. So if you guys don't have any more questions, that is it for today.
How much is lipo 360, BBL, plasma, silicone implant? BBL is $37.50, right?
So for a lipo 360, we start from $3,250.
I know she was asking about BBL.
BBL starting, yes.
$37.50, right?
Look at this right
And
here.
then
right here.
implants is what? $3,500 or something?
For silicone implants, we have them starting at $3,500. So it
Yeah.
totally depends on what exactly you want. It depends on your body, whatever procedures you want to get. Okay, but we are
she
here.
has J plasma.
J
$1,500 per area.
J plasma is in between 1,000 to 2,000 per area. It just depends the area you want. So go ahead, and if you're interested, send us your name and full name and your number, and we can get back to you with that. Okay. Linda says a mommy makeover. Do you have any specific questions with the mommy makeover?
Sure, we'll do it.
We will do a mommy makeover. What does the mommy makeover include? Why don't you explain that to our...
Mommy makeover includes typically includes a breast lift with the tummy tuck.
Breast lift with a tummy tuck. Can you do any other breast procedures with that, or is it
Or
just...
you do implant, breast implant with tummy tuck. You can do breast implant and breast lift with the tummy tuck. But like I said, breast lift with an implant is depends on the patient. Okay.
Okay, so it totally depends on the patient, but awesome. Marissa, I know you were asking about a few prices. Go ahead and just send us your full name and your number, and then we will definitely get in contact with you and then give you those specific prices so you know. Like I said, we have amazing deals going on right now with Dr. Dang, so do not miss out on this opportunity. It is October. It's basically November. It's the end of October, and these prices are going to be gone. And I don't know if they're going to come back. Probably not. So now's your chance, guys. Send us your full name and your number. All right. All right. So any other question, guys? Any other questions here for Dr. Dang? Like I said, he's an amazing surgeon, guys. I recommend you go onto our Instagram page, take a look at his results. They are all amazing. And then go ahead.
Mommy makeover, BBL at the same time.
Okay, there you go. Extra question.
Can I get a mommy makeover and a BBL at the same time? That's a lot of surgery. So yeah, usually I like to do a combo of two, two procedures. But depends on the patient. I mean, if you're very knowledgeable about what's happening, you're very able to take care of yourself very well. You're young and you're healthy. Then yeah, but it's very patient specific. But 3 surgeries is a lot. Okay.
Very good, very good. Okay,
Yeah.
so just make sure you're aware of that. Okay, guys, thank you so much. Thank you so much. Thank you so much, Dr. Dang. I know he has some surgeries to do right now, so he's gonna be popping off.
My pleasure. We'll
But
see you
thank you,
guys on
guys.
consults or when you come down here. Okay.
Thank you. Oh, one more question. Ashley, hello, how are you doing? She says, I'm 5'7", 185 pounds, and type 2 diabetic with A1C 6. Can I get a mommy makeover?
Your A1C is awesome. Congratulations. You're doing a good job. 5'7", 185. What's the BMI on that?
Let's check your BMI. We're going to calculate your BMI. Just give us 1 second here.
5, 7,
And 185 pounds.
185. 28.9. So 29. That's pretty good. Yes.
There you go. Awesome. So guys, remember, make sure you send us your information and we will definitely be in contact with you with your free consultation with Dr. Dang. All right. Thank you so much. Thank you guys so much for joining us. Where are you located? In
Bye,
Miami,
guys.
Florida.
Miami.
All right. Bye. Take care.
See you soon.